Okay, so we have a nice lady. She's got a bit of an exposure keratoconjunctivitis with a bit of a neurotrophic component that's crept in. She's got pretty diffuse corneal staining. It's a bit hard to capture it for some reason, but she's got irregular tear film distribution. If I look from the side here, I can see as well she's got, with my optic section here, I can see she's got a bit of conjunctival chemosis as well. It's a bit hard to appreciate, but it's there nonetheless, which suggests that she's got a chronic inflammatory component that's present as well, leaky vasoendothelium, and with that the migration of pro-inflammatory cells and mediators toward the surface of the eye. And that gives you this, after a while of being like this, she has this reduced corneal sensitivity and sort of chronic downward spiral. You can kind of start to appreciate it there. Okay, very good. Okay, puede relajar, great. Helpful. It's always helpful if you have things set up already. So up to this point, my hands are clean. She's got a drop of proparacaine in each eye. My bandaged contact lens is open. It's not, it's the case is still full of fluid. I'll take out most of that so I don't introduce too much fluid to the front of the eye. I have my forceps, I have my rounded ophthalmic sponge, and the graft that we're going to use today is an Ophthalogix Eclipse graft single layer 10mm. All right. It's always helpful if you have an extra set of hands, ready to go. So I take out most of the fluid from the contact lens so it's wet enough to not start drying out and crinkling up, but not so wet that we introduce too much fluid to destabilize the newly adherent membrane, okay? So she's going to hold that. She's going to hold that, and I'm going to get my membrane out here. So when you open these, there are two levels of packaging, one inside the other. The first one, no problem. When you open the second one, if you open it too quickly, the wind can take the graft and you end up losing it. So I like to open that a little bit slowly, then kind of reach in here to retrieve it. In the package, that's what it looks like. We can see it right down here. This little circle down there. I'm going to reach right in and get it. Got it. I want to grab reasonably close to the center of it, okay? Now, these things are very, very thin, maybe 35 to 60 microns thick. They're so thin that just the convection of warm air movement, even from my hand there, you see it starts to bend away from my hand. When I get close to the front of the eye, that's warm as well. It's going to start to curl away from the front of the eye. The nice thing about this is that it's bidirectional. In other words, if it curls away one way, all I have to do is reverse it and it'll be curled towards the eye. A few seconds later, it'll start to curl again away from the eye, become flat, and I can put it right on. So Danielle's going to come stand right over here. You can come right around this side. Yep.
Should I move?
Nope. You're just right where you are. So you're going to be right over here where you can see. She's even going to turn a little bit. Okay, mira aquí a mi ojo. She's going to look right at my open eye. I'm just going to hold her eye nicely open like that. She's going to look at me. Mira mi ojo. No, mira mi ojo. No, nada incómodo. Mira mi ojo aquí. Easy and cool. Good, good. Nada incómodo. Good. Don't move, don't move. That's on. If I wait too long, it might move away from the eye, fold away from the eye, fold over itself even, and become hard to kind of smooth it out. So I like to use the smooth surface, the smooth backside of the forceps to place it. Now, while it's on, it does have a few folds. We put a two-dimensional flat circle on a 3D curved surface. It's going to fold a little bit. I want to roll it onto the eye a little bit. You can see those folds are diminished and somewhat pushed toward the periphery. That'll help her feel more comfortable. At this point, she should feel like everything became a little bit opaque, but it's going to get better. Okay, good. That's the benefit of having a third hand telling you. Now to put the contact lens on, it's easiest with my thumb when I'm in front of her. Just like that. Just like that. How about that? The membrane cooperates and the contact lens doesn't. Well, it can happen. Okay, she's going to look up, mira arriba. Mira aquí a mí. Lentamente cierre el ojo. Abre el ojo. Good. Okay, so now you have the membrane and the contact lens on the eye. Okay, you can see the outline of the contact lens, the membrane's there. Once she's blinked once or twice, that opaqueness is minimized, although it's still present. So let's take a look through the microscope and see what we see. Okay, so when we look through the microscope, we can see she's got a nicely centered amniotic membrane there. I'm not well centered, but the graft is well centered there. And she's got a nice contact lens over it. She's generally comfortable. The eye is otherwise quiet. So for the duration of treatment, she's going to use a non-preserved lubricant drop 4 to 6 times a day. She's going to also use a combination topical antibiotic steroid, probably Maxitrol in this case. We could also use Tobradex or Tobradex ST 2 to 3 times a day for the duration of treatment. That'll help keep the surface and the contact lens quiet and clear of infection, minimizing the bacterial load of commonly encountered ocular surface pathogens. We're going to minimize that. When you sleep with a contact lens on, because you're going to leave the contact lens on until we take it off, we'll probably take it off in about 3 days in this case. The two concerns you have are infection and oxygen. The infection risk is minimized by the antibiotic component of the drop. The hypoxic or oxygen flow component is minimized by using the risk of hypoxia is minimized by using the non-preserved lubricant drop multiple times a day, supporting the exchange of fluid and oxygen under the lens, and then the dexamethasone within our topical antibiotic steroid drop helps to offset any hypoxic sequelae safely and effectively for the duration of treatment, which in most cases won't be longer than a week. So we'll see her in a few days and see how she's doing.